Hi, my name is Dr. Gary D'Ambrosio, and the purpose of this short video is to kind of explain to you what is BodyTalk fascial energetics, and how is it going to help you in your clinic? Why should I take this class? So the first thing you should already know is that our body is made up of energy. Our body has over 100 trillion cells. Each cell has about 100 trillion atoms. So you think of the atoms that are in the human body. We have nitrogen, oxygen, carbon, etc. So if we look at the carbon atom, for example, it has a nucleus, protons and neutrons, and the carbon atom is made up of 6 protons and neutrons inside that nucleus, and around it are electrons, about 6 of them. Let's give it a size. Let's give the protons and neutrons maybe the size of a small little BB or a pearl. If we were to place that in the center of a football field, right, the electron field, those 6 electrons, would be the size of the stadium. So 99.9999999% of this atom is basically empty space, but it's not empty, it's energy vibrating. So let's put this in perspective. Your body has 100 trillion cells. Each cell has 100 trillion atoms. Each atom is about 99.9999% empty space. It's energy vibrating. And all your tissues of the body are made up of this. Your skin, right? Your fascia, your bones, your muscles, your joints, your organs, everything is made up of this. Now, quantum physics, quantum entanglement, tells us that everything is in a constant communication. So what does that mean? So every proton and neutron, every electron are in constant communication, right? So the atoms are in constant communication. The cells, the tissues they form, the organs they form, right? The systems they form are all in constant communication. And BodyTalk teaches us that. And BodyTalk does a great job of improving this communication. And so clinically, when this happens, we see changes. We see changes in posture, range of motion, decreased pain. But sometimes there's something left. And that's what this class is about. Sometimes there's still an energetic lesion that's left. Let me give you an example. Let's say you go out for a run one day and everything's fine. You're in a good mood, but you trip over a tree root and you land on the ground and you don't injure yourself, right? Well, let's say one day you've got some decisions to make, right? You have to plan something, you're worried about it, you're concerned, maybe frustrated, you're not coming up with the solutions. And you're very full in your mind and you want to go for a run to clear your mind. Now, remember, if you look at the acupuncture meridians, the spleen meridian is on the inside of that leg and ankle. The gallbladder meridian is on the outside. So, planning, decision-making, anxiety, worry, all those different things, frustration are going to affect those meridians and therefore stabilization. So this time when you go for a run, you trip over that little root and now you injure yourself, okay? And you go see a BodyTalk practitioner and they identify, maybe the gallbladder, maybe the liver, maybe the spleen. They identify the emotions, the worry or the anxiety, the frustration, which is part of anger. They may have a consciousness of planning and decision making. So you tap all these things out, and the person does feel better, but there's still a problem with their ankle. There's still a lesion that's there. And so this class is there to not take the place of BodyTalk, but add to it. So the question you got to ask yourself is, how does an ankle heal? Well, we know this from module 1 that there's blood supply carrying oxygen and nutrition from the heart to that ankle, but also there's energy supply, there's nerve supply. In order for that ankle to receive it, you got to get rid of the toxins. So there has to be venous drainage, lymphatic drainage, and also energy flow. So there's a pathway, right, that goes to and from that ankle. So in the fascial energetics class, we teach you to identify where's the problem. Is it locally around that ankle? Is it in the fascia, is it in the bone, a joint? Is it in, energetically, is there an emotion there? What's happening? Or is it along that pathway, right? That pathway from the ankle to the heart. So maybe the diaphragms, maybe the autonomic nervous system, maybe fascia, other parts could be involved. So in this class, we learn to identify it and we create these energetic holograms because everything is energy. We can work with a bone, a joint, an organ, anything. And we come from a place of attention, and we teach you to use all your senses, right, to make a change. Now, if you want to see this in action, you could go to the BodyTalk Facebook group in Singapore, Sufin's group. I've taught there many times, and she has lots of videos there you can see. And the reason why I send you there is because you see before and after. You'll see me in a class where I bring students up, and they may check a shoulder, a joint, or an organ, and I do the energy hologram, and all of a sudden everything clears up. There's better range of motion, there's better posture. Also on my website, my name D'Ambrosio, the D'Ambrosio Institute. If you go to the YouTube page, I have lots of videos of me doing this kind of technique in class. We're teaching this online. It's over 6 days. I think it's from 12 to 4 each day. I like to spread it out so you can learn it in a nice organized fashion. You're going to get a workbook. You're going to get a color chart with this. And we teach it online on Zoom. And so I'll be lecturing here on the main screen, showing you the PowerPoints and that. And then you go into small breakout rooms where we break things down, make sure you understand it, and you'll be one-on-one with another student doing this over a distance, applying it right away. So my expertise in this comes from over 30 years of clinical experience. I'm an osteopath. I'm a doctor of oriental medicine, a physical therapist. I was an athletic trainer. I've been involved in BodyTalk since about 1998. I'm a senior BodyTalk instructor, an advanced instructor, and a practitioner with that. Now, if you have any questions at all, don't hesitate to email me. My name, Kerry, K-E-R-R-Y, jdam@gmail.com. So kerryjdam@gmail.com, or my clinic phone number in Sarasota, Florida, 941-907-9250. Okay, so if you have any questions. So hopefully this was helpful, and hopefully we'll see you there at the course. Thank you.